Now, his son is using AI to improve mental health care. And joining us now is Zak Williams, mental health advisor for Headlamp Health, which recently launched Lumos AI to help those in need of mental health treatment. So, Zak, thank you so much for coming on tonight. It's such a pleasure to see you. Tell us about why you decided to get into the AI space. I know that this wasn't something that was in your plan.
Well, actually, first off, thanks for having me. Secondly, I studied AI as part of my undergraduate degree. I was a computational linguistics major 20 plus years ago, and I've been involved within the space for, at this point, about 20 years. So this specific wave of AI, in terms of investing and advising in infrastructure, specifically in the behavioral health space, started happening about 5 years ago. I am very passionate about mental health. I find that service is my path to healing from the trauma associated with my father dying by suicide. So I'm very excited about what Lumos is doing and believe that precision neuropsychiatry is greatly augmented through artificial intelligence.
And Zak, I was reading about your story and more broadly, people who suffer from mental health issues, and 49,000 people in the United States died by suicide in 2024. But then there are hundreds of people who are close to those who take their own lives who also suffer from mental health issues. So what is Lumos AI doing to help those who maybe are trying to find a way after losing a loved one?
Well, what Lumos AI does is it greatly improves the diagnostic environment associated with understanding respondents versus non-respondents for things like clinical trials. So it ultimately endeavors to greatly improve the standard of care through more precision diagnostics, both through the trialing process of discovering new drugs, but also through providing more precise treatment in terms of establishing a diagnosis for patients and the like. So the goal is ideally to identify indicators of things like depression, of suicidal ideation, and so forth early on before it becomes a crisis situation. So, you know, the great thing around platforms like Lumos AI is that they're able to really identify issues very early on in a patient's journey.
What is your message to those who may be afraid or think that there's a stigma around pursuing mental health care? Is this new technology able to break through those barriers to get people the help that they need?
Well, I think it's part of the toolkit, right? I'm a big fan of prioritizing mental health every day. We need to prioritize things like great sleep, nutrition, community connection, in many situations, you know, a spiritual practice and so forth. We need to build that toolkit so we can orient around building this resilient, healthy foundation. And then when we hit a point of crisis or we need to see a clinician, we have this advanced tool set like Lumos AI and other other precision protocols like it that can provide solutions that help better navigate folks when they're in dire need.
Well, it seems like a wonderful thing for people who may need some help. Zak Williams, thank you for sharing with us, and check out Lumos AI if you want more information. Thank you.
Thank you so much. Have a wonderful evening.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.